Okay, History and Development of Play Therapy, Dr. Lander's book, Play Therapy, The Art of the Relationship. Chapter 3. Birds fly, fish swim, children play. Play has long been recognized as occupying a significant place in our lives. As early as the 18th century, Rousseau wrote about the importance of observing play to learn about children and understand them. In Emile, he expressed his ideas on training up education of children, observing they're not tiny adults. Sometimes the people who come into our counseling sessions are children, adults who've been expected to be tiny adults all of their life. The Education of Man, Froebel emphasized the symbolic components of play. Freud wrote about Little Hans, his seminal work. And starting in this chapter, we're looking at different theories that are involved in play therapy. First one is psychoanalytic. Following Freud's work with Hans, Hermine Helmuth is considered to be one of the first therapists to emphasize play as essential in child analysis to provide children in therapy with play materials to express themselves. Her work predates Anna Freud and Melanie Klein, but she did not formulate a specific therapeutic approach. She did call attention to the difficulty of applying methods of adult therapy to children. Kind of the same problems we're having now. 1919, Melanie Klein began to employ techniques of play as a means of analyzing children under 6 years of age. She assumed that a child's play was motivationally determined, similar to free association of psychoanalytical work with adults. She substituted play for verbalized free association to provide her with direct access to the child's unconscious. Anna Freud began to use play as a way to encourage children to form an alliance, but Anna emphasized the importance of developing an emotional relationship between the client and the therapist before interpreting the unconscious motivation. For today's work, it is important that we understand that we tentatively discuss with the client what the symbolic play means to them, and we don't just assign clinical interpretation. We let the client tell us what it means. We can make appropriate feedback. We can have clinical assumptions and understandings, but we do need to collaboratively involve the client. Klein and Freud both stressed the importance of uncovering the past to strengthen the ego and believed that play was the medium through which clients expressed themselves most freely. Melanie Klein used play as a way to encourage children to express fantasies, anxieties, defenses that she then interpreted. A major difference between Melanie Klein and Anna Freud was Klein's heavy reliance on interpretation of preconscious, unconscious meaning. She saw symbolic meaning, particularly sexual, in almost every play activity. It's true that sexual abuse and trauma will come out in symbolic play, but that does not mean that every single thing that a client does in the playroom points back to sexual abuse and trauma. Klein explained the significance of interpretation by describing a play therapy episode with a child. That is there for you to read on page 30. Anna Freud used children's play primarily as a means to facilitate children's positive emotional attachment, a way to gain access to the client's inner life. A major objective she had was to influence the child to be like her, a little bit less than what we would try to do today. We have a great deal more understanding of guarding against that type of countertransference. Since free association developed by Sigmund Freud was cognitive, Anna Freud modified her structure to more an affective level. Release play therapy, this is for aggressiveness. This is David Levi, 1938. Release of aggressive behavior by throwing objects or balloons against something like a target. Some attachment disorder. He worked a lot with children that were attachment disorder with rocking and trying to help foster adoptive parents go back in and provide some of the nurturing for a child that was lost for that child during infancy. There's a case study on page 33 that explains Dr. Levi's work. Gove Hambridge extended Levi's work, structured play therapy, more direct, introducing events, playing out situations, allowing children to have free play to recover from intrusive procedures. Relationship play therapy with Taft and Allen, 1933 and 34, became known as relationship therapy versus play therapy. It was kind of a third significant development in play therapy. Otto Rank in 1936 de-emphasized the importance of past history and the unconscious and looked at the work that we were doing in the here and now, much more from a Gestalt perspective, much less interpretation of the child's play. Non-directive play therapy, Carl Rogers, which was later then, that was kind of the fourth major development. It was expanded by Virginia Axline, 1947, Dibs in Search of Self, is the book she wrote. She was a student of Carl Rogers. Very non-directive, client-centered work that was then expanded upon by Dr. Landreth into child-centered play therapy. Play therapy in elementary schools with guidance and counseling programs in the 60s opened the door kind of to the fifth force, the fifth major development. You begin to see people as Dr. Landreth, Muro, Myrick, and Holden, Waterland, describing their own play therapy experiences as clinicians in the professional literature. The Association for Play Therapy in 1982 was developed by and founded by Charles Schaefer and Kevin O'Connor. They founded a publication, the International Journal of Play Therapy, a conference held every year in October. A rapid gain to 4,000 members in 2002. They are located in Clovis, California. The on-site of university trainings like Dr. Lander's University of North Texas for people who want to become play therapists, or Brighter Tomorrow's Consulting Institute for people who want to become play therapists. Filial therapy by Bernard and Louise Gurney, a husband and wife team in the 60s. Dr. Landreth has also expanded this therapy. Filial meaning that we include the entire family, siblings, parents, adoptive parents. And we teach families how to play together. Dr. Schaefer has worked with adults. Play therapy in adults is also something that we do in depth here in this practice. Play therapy techniques and family therapy, how to show families the necessity of having fun, of understanding that play is not just the work of a child, but play is how we socialize ourselves and how we resolve conflicts. Group psychotherapy, group play therapy, Dr. Chaim Ganot and Linda Homeyer, the Handbook of Group Play Therapy. Play therapy in hospitals, play therapies in prison systems, play therapy in nursing homes, play therapy in schools, play therapy in counseling centers. Ray, Bratton, Ryan, and Jones, 2001, conducted a meta-analytical research of 94 case studies focusing on the efficacy of play therapy as a viable psychotherapy intervention with a large positive effect of play therapy on treatment outcomes with children, effective across modalities, age, gender, clinical, non-clinical, population settings, and across trans-theoretical, across different theories. A very effective therapeutic approach. We're dealing with hair pulling, selective mutism, aggressive behaviors, emotional adjustment, issues around divorce, abuse, neglect, sexual abuse, domestic violence, stress, anxiety of hospitalized children or children with chronic illnesses or terminal illnesses, academic issues, maladaptive school behavior, speech problems, emotional and intellectual problems of children on the spectrum, better social and emotional adjustment, stuttering, psychosomatic difficulties, depression, anxiety, lowered self-esteem or self-concept, and separation or social phobia. So that is this chapter. And thank you guys. We'll see you again.